Hello everybody. Today I will talk on nutritional management of lactose intolerance. What is lactose? It is a disaccharide. It is a natural component of food present only in milk and dairy products. Lactose is acted upon by the enzyme lactase and produce glucose and galactose. What is lactose intolerance? And there are three types of lactose intolerance: primary lactase non-persistence, secondary lactase deficiency, primary or congenital lactase deficiency. Now something about the primary lactase non-persistence. It is a genetically determined reduction in the quantity of lactase, and it is most common form of lactose malabsorption. The great majority of the world's population develop low intestinal lactase during the mid-childhood, that is approximately at the age of 5 years. And this finding is most prominent in the Asian and African populations, and it is rare in the Caucasian and Scandinavian populations. The exact molecular basis of this condition remains unknown. Now something about the primary or congenital lactase deficiency. It is a rare recessive form of disorder, and it is characterized by absence of lactase activity in the small intestine with the normal histologic pattern of the small intestinal mucosa. And the affected individual develops diarrhea from the birth, and they also have hypercalcemia and nephrocalcinosis. Now I will talk about secondary lactase deficiency. Secondary lactase deficiency may be caused by bacterial overgrowth or stasis and mucosal injury leading to villus flattening and villus damage. Secondary lactase deficiency due to bacterial overgrowth and stasis. In this condition, there is increased fermentation of dietary lactose in the small bowel, which leads to symptoms of lactose intolerance. And it is suspected from clinical history and from a very early peak of breath hydrogen during lactose tolerance test. Now, secondary lactase deficiency in case of mucosal injury leading to villus flattening or villus damage. This occurs in case of celiac disease, Crohn's disease, radiation enteritis, chemotherapy, HIV enteropathy, Whipple's disease. And during this condition, the lactase is usually the first affected disaccharide because of its distal location in the villus. The treatment of the primary disorder can lead to the restoration of the lactase activity. And restoration of lactase activity lags behind the return of the normal intestinal morphology. Now, about the clinical manifestation of lactose intolerance. A patient with lactose intolerance developed crampy abdominal pain, which occurs in the periumbilical area and in the lower quadrant of the abdomen, and there is bloating, flatulence, diarrhea, vomiting, and stools are usually bulky, frothy, and watery in nature. How can we diagnose lactose intolerance? Lactose intolerance can be diagnosed by lactose tolerance test and lactose breath hydrogen test. In case of lactose tolerance test, about 50 gram of lactose is given orally, and blood glucose level is determined at the start and at 60 minutes and at 120 minutes. Increase of blood glucose by less than 20 milligram per deciliter with associated symptoms is diagnostic of lactose intolerance. And this test is about 75% sensitive and 96% specific. The other test, that is lactose breath hydrogen test for the diagnosis of lactose intolerance. Orally, 2 gram per kilogram body weight lactose is given, and breath hydrogen is sampled at baseline and at 30 minutes interval for 3 hours. Breath hydrogen value of 10 ppm is normal and 10 to 20 ppm is indeterminate unless the patient is symptomatic, and breath hydrogen value more than 20 ppm is diagnostic of lactose intolerance. There are some conditions which can mimic, or in other words, there are some differential diagnosis for the condition of lactose intolerance. These are irritable bowel disease, inflammatory bowel disease, cystic fibrosis, diverticulitis, celiac sprue, acute gastroenteritis, giardiasis. In the above mentioned conditions, the patient may produce symptoms which mimic the symptoms of lactose intolerance. Now, about the treatment of lactose intolerance. In the absence of any correctable underlying disease, the treatment includes four general principles. Number one, reduced dietary intake of lactose and substitution of alternative nutrient sources to maintain energy and protein intake. Administration of a commercially available enzyme substitute and maintenance of calcium intake, because in the case of lactose intolerance there is a higher content of calcium in the blood and there is risk of nephrocalcinosis. Now infants with lactose intolerance may be given breastfeed, or alternative to breastfeeding, they can be given lactose free formula which can be milk based or which can be soya based. Now, breast milk, it provides nutritional elements, it provides immunoglobulins, that is antibodies against enteropathogens, and it provides hormones which promotes the mucosal proliferation and recovery. And lactose-free formulas, the lactose-free formulas are milk or soya-based. These formulas accelerate the recovery of intestinal mucosa. Now at the end, I will give some tips for increasing the tolerance of lactose in a patient with lactose intolerance. This can be done by taking gradually larger amounts of lactose containing milk, by drinking milk with milk rather than taking milk alone, and by eating smaller quantities of milk but more frequently, and by taking dairy foods with active bacterial cultures. Thank you very much.